So I've checked the doctor's orders and I'm closing the curtain to provide privacy. Good morning.
Good morning.
My name is Irene and I'm a nursing student and I'll be working alongside your nurse today and taking care of you. Is that okay?
Yes, ma'am.
Important hand hygiene. Can you please tell me your first and last name and date of birth?
It's Emma Prekop. It's 07/25/1998.
Do you have any allergies?
No, ma'am.
I'm going to ask you a couple questions. Do you know what today's date is?
It's September 7th.
And do you know where you are?
I'm in the hospital
And what brought you here today?
for a headache.
For a headache. And on a scale from 1 to 10, 0 being the worst pain and 0 being no pain, and 10 being the worst, how would you rate your pain today?
A 2.
A 2. Okay. I'll make sure I document that in the chart. I am going to raise your bed up so that I won't strain my back. And do you need to be adjusted, set up, or laid? Okay, very good. All right. I'm here to do a head-to-toe assessment, and that includes looking at your heart, checking your abdomen, your bladder, looking at your eyes and your mouth, and checking the strength in your upper and lower extremities. So before I get started, do you need to use the bathroom?
No, ma'am.
So I've looked at the patient's skin and I've assessed that I don't need to wear gloves. Her skin is intact. I don't see any sores or anything like that. I'm going to start off first with checking your eyes, and I'm going to check to see if, and I need to put the side rail down. And so I am going to check to see if your pupils are round, equal and round, and reactive to light and accommodation. So I'm going to start off first with just shining this light in your eyes briefly. If you will, please look at my nose. Very good. Now I'm going to do a combination. If you can look at this pen, I'm going to bring it very close to your face to check to see if your pupils dilate while it's away and constrict when I get closer. Ready? Very good. Now I'm going to check your mouth for any abnormalities in your tongue, if there's any thrash, your teeth, your gums to see if there's any swelling. Good. Okay. Now I'm going to check your heart sounds for rate, strength, and rhythm.
Okay.
I'm going to start off with the aortic valve, second intercostal, sternum border. The pulmonary valve, second intercostal, sternum border. The tricuspid valve, fourth intercostal. And your mitral valve, and the fifth intercostal midclavicular line. And everything sounds good. Inspecting the chest for rise and fall. And that looks normal. And now I'm going to check your lung for breathing sound. And I'm going to listen to all 5 lobes, listening for your breath sounds. 10 in the front, 3 on the right, 2 on the left, and 12 in the back. Okay? If you will, please take some deep breaths as I do this. Very good. I'm going with the shirt. Deep breaths. to start laterally on your right side. Okay, if you can sit up for me, I can do the back side. Take deep breaths. Okay. So next I am going to check the abdomen. I'm looking at the abdomen. Abdomen is just a little round. I just want to ask, have you had any pain, nausea, or diarrhea? Okay. So I'm going to listen to the bowel sounds for um, any clicks or gurgles. And I'm going to listen to the 4 quadrants, starting from the right lower quadrant, ending in the left lower quadrant, 15 seconds per quadrant. Okay, everything sounds normal. Now I'm going to palpate her tummy to see if there's any masses or any other abnormalities. Let me know if there's any pain. I'm going to also palpate her bladder as well again, to check to see if there's any masses or any other abnormalities. Is that okay?
Yep.
No pain here?
No pain.
Okay, good, very good. Okay, so now I'm going to check for skin turgor to see if she's hydrated, and it does. Spring pulls right back. I'm going to check the skin, and she's warm to the touch, not clammy. I'm going to check your radial pulse. And that's normal. The brachial pulse. That's normal. You're going to check for her capillary refill to see if it fills within 3 seconds. That's good too. Now I'm going to check your lower extremities. Can you grab onto my fingers, checking for equal bilateral strength, and that's good as well. I'm going to check for flexion of the feet, the strength of the feet. Can you push your feet towards my hand? Push it down. I'm also going to check the Doralis Pedis pulse for rate, strength, and rhythm. And that's good as well. For a capillary refill on the toes. Okay, and that is in 3 seconds. All right, so everything sounds good and looks good. I'm gonna put your bed down. And give you your call light. I'm gonna also let your nurse know about your findings, and we're gonna compare and see if your results has gotten better or has worsened. Is there anything you need?
Okay.
Okay, so let me move while I check on you.